on to talk about the GFR and the filtration fraction. Now, think about your renal plasma flow. Now, try to explain what some of these figures are as we go along. But don't worry about memorizing anything. This is just for you to understand the overall function of the kidneys, right? Now, the renal plasma flow is pretty much how much blood is going to your kidneys, okay? This is just in general. If you were standing at the renal artery, how much blood is coming in and going to my kidneys per minute? That number is 625 milliliters. So that means coming from your heart, coming from your cardiac output, 625 milliliters goes right to your kidneys. When we look at GFR, now GFR is a rate, so it's going to be 125 milliliters per minute. We talked about that figure already. And what does that GFR tell us? How is it different from renal plasma flow? GFR is talking about what? What's filtered, thank you. Specifically, what's filtered. So all the blood that goes to the kidney, 625 mLs, only 125 mLs per minute is actually filtered. This tells us something very important. Only a small percentage of the blood that goes to the kidneys is actually filtered, right? And this is what we call the filtration fraction. If you took 125 milliliters, and you divide it by the total amount of blood that's coming into the kidneys, this is about 20%. Right? So 20% of blood is filtered from all the blood that comes into the kidneys. It's a very important relationship to understand. GFR versus filtration fraction. Now, when we compare this GFR, we compare this systemic pressure to the pressure in your regular capillaries, we can see that it's significantly higher. So the filtration pressure in a typical capillary is about 2 millimeters. Whereas on our previous slide, we just calculated it to be what? What did we calculate our glomerular filtration pressure to be? We just calculated there, 16. We just calculated it to be 16. And so our glomerular capillaries have a much higher pressure than our typical traditional capillaries, which have a filtration pressure of 2 millimeters. And if you look at the filtration rate, the glomerular filtration rate is 180 liters per day. That's a lot of blood being filtered. Whereas your typical filtration rate in your regular capillaries is about 3 liters per day, so significantly less. This just tells us the glomerulus is under much higher pressure and it's functioning much more in terms of filtering a larger quantity of blood. Okay? So we talked about this, the filtration fraction. That's represented as a percentage. So again, can anyone remind us how we got that 20% and what that 20% means? So in your own words, what does that 20% even mean? What does it mean in terms of renal function? Okay, so only 20% of your renal plasma flow, right, which is all the blood that came to your kidneys, only 20% is filtered. Correct. All right, then we get to talking about the concept of filtered load, and filtered load is your GFR multiplied by whatever you're talking about. So when we talk about filtered load, we're typically talking about a molecule. Let's take glucose, for example. If my GFR is 125 milliliters per minute, all right, and my plasma glucose is about 1 milligram per deciliter, then I can calculate my filtered load of glucose to be 125 milligrams per minute. And what this means is that in every minute, my kidneys are filtering 125 milliliters of blood. Also, they're filtering 1 milligram for each of those milliliters per minute. So at the end of the day, my kidneys will filter 125 milligrams of glucose every single minute. And that's how we calculate filtered load, and that's what filtered load means. How much of the specific molecule is being filtered, and you can calculate it. You can calculate that by knowing the GFR right? Which is usually around 125. Again, that can vary depending on different disease states and age, etc. And then you multiply that GFR by the plasma concentration of the molecule in question. Okay? And so filter load is different from filtration fraction because filter load is looking specifically at one molecule, one item, maybe it's sodium, maybe it's amino acids. In this case, we're looking at the filter load of glucose. Now we're going to move on to talk about the regulation of GFR. And so we know GFR to be the amount of blood or the amount of volume of plasma that is filtered daily. And that's about 180 liters. So 180 liters goes through your glomerulus every single day. But only 1.5 liters of urine is excreted. What does that tell us? What does that tell us? We filter 180 liters, right? And we excrete 1.5 liters. What does that mean in terms of kidney function? We reabsorb a lot. Perfect. We reabsorb quite a lot of that. Almost most of it, 99%. Okay? And so a very small amount is actually excreted as waste. It's actually excreted as urine. Now, in order to regulate this GFR, we can do several things to regulate it. So GFR is highly regulated. And by highly regulated, I mean we can increase different factors in the body. We can increase the constriction of blood vessels. We can increase blood volume. And we can change or manipulate or influence the GFR by regulating certain external factors. And we'll talk more about the details of that as we go on. Now let's look at this graph. This is where we look at the glomerular filtration rate and we plot that against our mean arterial pressure. Does anyone remember what mean arterial pressure is from last semester?
Heart rate, stroke volume, and peripheral resistance.
Not, so you're on the right track. So stroke volume, like track. So you give me the calculation, which is fine. So what is mean arterial pressure? Right, so that's systolic over diastolic. Do you remember that calculation? Right, systolic pressure divided by your diastolic pressure. And that's your mean arterial pressure. Now, what does mean arterial pressure mean? So you can look at the calculation, but what does it mean? This is a measure of the overall output of the heart. So think about your mean arterial pressure as your blood pressure, essentially. How perfused are your vital organs, right? So this is your blood pressure. And what we can see here is that as mean arterial pressure rises, so does GFR up until this point, right? At this point, we can see that the mean arterial pressure is rising, but the GFR is not, in between 80 and 180. The mean arterial pressure is rising, but the GFR is not. It's staying stable at 125 milliliters per minute. Why does it do this? Why does it not continue to rise directly proportional to the mean arterial pressure? This is what we mean by regulated. The kidneys cannot just have a high GFR. They have to maintain a very tight window of the GFR. And so in between a blood pressure or a mean arterial pressure of 80 to 180, the GFR stays the same. The GFR stays the same. This is a way of the body maintaining the perfusion of the kidneys. Okay? And so if we go above 180 in terms of our mean arterial pressure, we'll then start to see a sharp increase in the GFR. Okay? So the kidney basically holds out as long as it can. It tries to keep that GFR at the same number for as long as it physically can. And it's going to alter all types of different external factors like the constriction of the vessels and the fluid, and it's going to try to keep the GFR stable. That's one of the main jobs of the kidneys, It's very highly regulated. GFR should not be just, going up, down, crazy. It needs to get 125 milliliters per minute, and very rarely does it go outside of that window. At extremely low blood pressures, think about if you're hemorrhaging, think about if you're dehydrated, extremely low blood pressures, the kidney also loses. It has to give up. GFR has to drop. It's trying to maintain perfusion. It's trying to maintain a stable GFR of 125, but below a certain perfusion, you're basically heading for shock. You cannot preserve your renal function if the rest of your body is collapsing. And so lower than 80 in terms of mean arterial pressure, we see a sharp decline in the GFR as well. All right, any questions on that? All right, so let's talk about the intrinsic regulatory factors of GFR. These are the things that the kidneys can do themselves to regulate GFR, hence the word intrinsic. All right, so think about some sort of change being brought about, and that change is coming from the organ or the person or the structure themselves. We talked about intrinsic regulation in the heart, where the heart controls its own rhythm. Very different from extrinsic regulation, such as nerves and the somatic nervous system and the autonomic nervous system, right? And so when we look at the intrinsic regulatory factors, there are three of them. The myogenic regulation, this has to do with the smooth muscle in the walls of the arterioles. They are going to contract in response to stress. So again, think about blood washing past the efferent arterioles. We have the afferent arterioles, we have the glomerulus, we have the efferent arterioles. And remember I told you that these structures, the mesangial cells, the juxtaglomerular apparatus, the structures of this apparatus are sensing the flow of blood in the efferent arteriole, as well as of the ascending limb of the loop of Henle. And it's basically detecting from those structures things about the tone, things about the blood pressure. The blood pressure is too high in those vessels, it's going to relax the vessels, and that's going to cause vasodilation, that's going to bring the blood pressure down. If we're stretching, if the blood pressure is too high, it's going to respond by contracting, right? And so their myogenic, myo meaning muscle, that change that happened, that regulation that happens in the smooth muscle of the arterial walls is one of the ways that the kidneys can regulate themselves. The second way is the tubuloglomerular feedback. And this is basically brought about by the macula densa. Now, the macula densa are these group of cells that line the distal collecting, the distal convoluted tubule, as well as the ascending limb of Henle, limb of the loop of Henle, sorry. And so the macula densa cells are determining how much sodium, what's the pressure in the fluid that's flowing past them, right? And so we determine whether or not we have to increase or decrease our blood volume depending on the flow across those macula densa cells. Now, the way that these cells stimulate that response is in a paracrine fashion. Paracrine meaning that they're going to send certain paracrine factors to the cells that are directly around them. This is not an autocrine or an endocrine function because this is not going to be a widespread function. It's simply going to affect the cells that are in the immediate vicinity of these macula densa cells. So I'll repeat that again, just to recap. The tubuloglomerular feedback is where the macula densa cells are detecting the amount of flow in the blood that's passing, in the fluid that's passing them, and then they're going to fine tune by secreting certain paracrine factors in response to that flow. The final mechanism here is called mesangial cell contraction, and we're really not going to talk about the details of this, but there are certain mesangial cells that are also acting as sensors, that are also sort of testing the temperature and making fine-tune adjustments. So these three mechanisms are how the kidneys can regulate themselves. So we'll talk about some external regulation in a minute. Okay. Now this slide is just pointing out that apparatus, which is composed of the macula densa cells of the loop of Henle, the extraglomerular mesangial cells, as well as the macula densa, the juxtaglomerular apparatus, and the extraglomerular mesangial cells. Right? Now let's talk a little bit more of the details. Let's look at an example of that feedback. Any questions so far? So let's look at the details of these two examples. So on the left, we have an example of myogenic regulation. And on this side, I want you to think about muscle. So myo meaning muscle, and genic meaning the regulation or the fine tuning of the muscle, the smooth muscle in the arterial walls. The second example has to do with tubular-glomerular feedback, and this is specifically talking about the macular denser cells, and they're being able to detect the flow that happens across the lubricant. Okay. So let's look through the example on the left. So we have an increase in mean arterial pressure. That increase in pressure sends a signal to increase the stretch response of the smooth muscle in the arterial walls. This causes the wall to do something in a response. It's going to constrict. So when there's stretch in that wall, as a reflex, it constricts. Okay? And that constriction increases the resistance, meaning that we're going to increase the pressure or the resistance in that vessel. That's going to in turn do what to our glomerular capillary pressure? If we have more resistance in our glomerular capillaries, we're going to decrease our GFP. We're going to decrease the glomerular capillary pressure, or the filtration pressure. And what do you think is going to happen as a response? So if we decrease the glomerular capillary pressure, what's going to happen? The blood volume? Okay. So we have an increase in mean arterial pressure, which is increase in blood pressure. And so this is pretty much going to equalize or regulate our GFP, right? If we had a decrease in mean arterial pressure, we would need to get our GFP up. Okay. On the right side here, all right, so we didn't go over this second part here. So the second effect here is that if you increase your glomerular capillary pressure, that's more fluid moving across your capillary membrane. Remember those three layers of that membrane, which is increasing our GFR. And that's what we want at the end, right? Similarly, on the tubular glomerular feedback side, we have the macular denser cells, right? The only difference here is that there's macular denser cells. There's not that stretch reflex. And these are going to detect the increase or decrease in flow. And increasing in that flow is going to increase those paracrine factors. So the release of those paracrine factors, which in turn cause constriction of the blood vessel, which in turn cause increased resistance, which helps to regularize your GFR. So the big take-home picture in these two pictures is on the left side, we have myogenic response. An increase in mean arterial pressure eventually increases our GFR. And this is brought about by decreasing or constricting the vessels. And this response is myogenic. It happens with the muscles of the smooth muscle wall, of the blood vessel wall. On the right side, similar effect being brought about but a different mechanism. This is where the macular denser cells are determining the flow of blood across them. And in the if there's an increase in flow, they're going to increase their secretion of those paracrine factors, and that will bring about the same response of constricting the blood vessels, of increasing resistance, eventually increasing our GFR. Okay, so this is one big cycle, two different mechanisms bringing about the same response. Increase in mean arterial pressure brings about an increase in GFR. And again, that third mechanism we're not going to go into the details of. It's just not that important. Moving on to talk about glomerular filtration. So this slide sort of, again, compares those two things we were talking about earlier. That very tightly regulated window of the GFR. Here we want to talk about some extrinsic factors of GFR. Now there are obviously things outside of the kidneys that are affecting the GFR. What are some of those things? What are some of the things outside of the kidneys that can affect GFR? Blood pressure, right? Which is influenced by blood volume, so your hydration status. What else? the autonomic nervous system, right? Whether you're in the fight or flight mode or the rest or digest mode, whether you have your epinephrine being engaged. What are some other external factors? Right, so disease status, disease state or body state. An older individual is going to have a slower GFR. We talked about this at the beginning. So those are things that are external to the kidneys that we really cannot control that can have an effect on GFR. If you decrease your blood pressure, if you're hemorrhaging, if you're sweating profusely, you are going to decrease your GFR, and that cannot be controlled, right? That's extrinsic to the kidneys. All right, so this brings us to that example. An example of severe blood loss, severe blood volume loss. So if we have hemorrhaging, if we have sweating, we lose quite a bit of our blood volume. This does what? This decreases our venous return. This decreases the amount of blood that's going back to the right side of the heart. Decreasing venous return has a direct influence on cardiac output, right? It's going to decrease cardiac output. If you're filling the chamber less, you're going to pump more out less. We talked about this connection last semester. Decreased venous return has a decreased cardiac output. You have less to pump because you filled less into the right side of the heart. This in turn causes a decrease in your arterial pressure. That's a decrease in your overall perfusion coming from the heart out to all your peripheral vessels. And if that decreases, what is the body going to do in response to that? What is the body going to do? It's getting less blood, it's getting less perfusion.
Shut off the areas, vasoconstrict the areas.
Right. Good. It's going to start to vasoconstrict those vessels. It's going to try to decrease GFR. Why? Because we're trying to preserve fluid here. We don't want to be filtering lots of fluid. We don't want to be making lots of urine. We're trying to hold on to as much volume as we can. And so GFR decreases right away, urine flow decreases right away, and the amount of fluid that we're losing overall goes down. We don't have excess fluid to lose in the case of a hemorrhaging, in the case of severe dehydration. Okay? And so that's the effect. That's the effect of what's happening there. Let's look at the feedback. What would the body try to do to sort of compensate this from happening? What could the kidneys try to do to help compensate this? So you sort of touched on it, Brian. They're going to, again, try to manipulate those vessels, right, of the renal system to help increase the resistance. Increasing the resistance means that we're going to try to help perfuse those vessels more. Now, again, there's a certain point between that 80 to 180 where the kidneys can help themselves. Outside of that range, they cannot. Right? Outside of that range, there's nothing we can do to keep GFR up. But within that limit of mean arterial pressure between 80 to 180, we can try to get the GFR back up if it's dropping. If it goes lower than 80, I'm sorry, you cannot preserve renal function, GFR plummets, urinary flow plummets, and fluid loss.